A patient's room during a code blue situation can become loud, crowded, and hectic. The recorder's role is pivotal to overcome these aspects by performing timekeeping and communication functions to keep the code team on track. By doing this, the recorder will help the code team leader guide serial assessments and treatments for the patient. Once assessments and treatments have been performed, the recorder ensures accurate documentation of them as well as the code team members who were present. In order to fill the recorder role, an individual must possess certain prerequisites. First, they must have baseline knowledge of the ACLS terms in order to interpret everything that is happening. Also, they should understand Team Steps communication techniques and how to use them to avoid errors, especially callouts, checkbacks, and cross-checks. Last, they should be familiar with the Code Blue record and evaluation forms to avoid confusion while documenting the event. This module will provide you with an orientation to these documents. During a Code Blue, the recorder has one main job: to accurately document interventions and the patient's clinical condition. While this may seem straightforward, it is a complex task to simultaneously record all activities as they happen while communicating critical time elements to the code team leader, such as the time since the last epinephrine, time since last defibrillation, and compression cycle times. Throughout the code, the recorder should also be aware of which team members are present in the room and make note of their attendance. At the code's conclusion, the recorder is responsible for obtaining the names and signatures of required participants and placing the record of the event in the correct location. The original copy should always be kept in the patient's chart, and the yellow copy should be sent with the code evaluation to the designated area. At UW-MC, these documents are placed in the pre-addressed red envelope located on the clipboard. At HMC, these documents are placed directly into the MCICU nurse manager's mailbox. Now that we have covered the recorder's role, we will move on to the documents that are used. This is an example of the current Code Blue record, which is made up of a timeline page and a signature page. The form has been designed to capture all pertinent information from a Code Blue in a script format and functions as the legal record of the event. The first area to note is the code specifics at the top of the timeline page, which is where the start time, date, location, and patient condition are to be written. Below this area is the timeline where all of the code events should be marked according to when they happened. The first block of the timeline is for noting assessments and treatments such as cardiac rhythm, whether compressions are occurring, or if a shock was administered. Next is the medication section to document when drugs such as epinephrine, vasopressin, or amiodarone were given. Make sure to note the route given. The third section is for documenting infusions that are given. Last on this page, there is an area for lab results at the bottom. The second page of the record is the signature page, where the patient's condition following the code is documented. The recorder should note initial cardiac rhythm, breathing status, vascular access, consciousness, as well as outcome of the code in this area. This page also has a diagram to help the recorder record the attendance of the different team members who came in to help with the code. Last on this page is an area to collect the signatures of the code leader, medication administering nurse, and the recorder. It is important to note that in some cases, more than one code record may be needed to document all the events. Following the code event, the recorder may want to review the data captured on the Code Blue form with the operations RN prior to submission. Among all of this information, there are a few items that are often missed and should be pointed out. These include the time the Code Blue was initiated, length of time to initiate compressions, the compression cycling times, times of defibrillations, length of time to achieve advanced airway with adequate oxygenation and ventilation, times that medications were given, and where the patient was transferred if appropriate. Next, we will cover the Code Blue evaluation form. Following the code debrief, which is led by the supervising MD, the Code Blue evaluation form is completed. The form is designed to document how well the code went, any complications that arose, and the corrective measures that were taken to resolve the issues. These questions are prompted through a series of yes or no type questions with an area for comments at the bottom. The recorder, in conjunction with the operations nurse, should fill this out immediately after the code has concluded. It should be sent with the yellow copy of the Code Blue record in the red envelope to the Patient Care Services office whose box is listed at the bottom of the form. This document should not be disclosed, distributed, copied, or placed in the patient's medical record. It is strictly for the administrative quality improvement purposes only. After watching this module, it should be obvious that it takes a certain amount of preparation to fill the role of the recorder. A successful recorder will be familiar with the hospital or clinical setting he or she is working in, have a solid working knowledge of the ACLS algorithms, be confident using TeamSTEP's communication techniques, and be familiar with the Code Blue record and Code Blue evaluation form.